Your younger children can have urinary tract infection. Yes, even your toddlers, they can have urinary tract infection. I saw a lady talking about it, and I decided to come and, because I know I have a first-hand experience on this, I decided to come and share this with you. UTI can happen to anybody, especially children, and one of the problems is that we don't always acknowledge it. We don't notice that is exactly what these kids are going through, especially when they are toddlers. They are not able to tell us their specific symptoms, what they are experiencing. Now, UTI can be, of course, bacteria caused. It's usually caused by bacteria, right? It can also happen through poor hygiene, when the cleanliness is not enough. Maybe the way you are cleaning your girl, instead of cleaning from front to back, you are cleaning from back to front, and then the poo and the rest of them go into the urinary tract, causing infection. Now, it can also be caused by a child holding urine. The time they're supposed to pee, they are not peeing. They are leaving the urine and holding it for long, because it can happen for a child, maybe a toddler who cannot express themselves, or a toddler who is afraid of something that is making him or her not to be able to communicate the way they should. They are not free enough to communicate. So that fear, and they are being terrified about something, they are not able to go on time to urinate. Now they are holding their urine. That is another thing that they do that can lead to that, because of that inability to visit the toilet. They are holding it for a long time. The urine inside the bladder will now reflux back, causing infection. Now, constipation can also lead to that. How? Because when there is constipation, the intestines are pressing on the bladder, and when the child pees, it leads to incomplete emptying. And when there's incomplete emptying, of course, it can lead to infection because it is not emptying properly. Now, in uncircumcised males, it can also lead to that, because, of course, they are at high risk of having infection because of the non-circumcision that they have. Now, not drinking enough water, it happens with children especially. They don't drink enough water. When they don't have enough water to flush their system, it tends to lead to accumulation of infection, because these kidneys need water to flush your general urinary tract. So now, if you don't have enough water in your system, it can lead to accumulation of bacteria. Now, product use can also lead to that. Maybe the product that you are using too many fragranted products, maybe the soaps or the baths, all those wash your hair, can lead the child to have this particular thing, because, of course, they are destroying her normal or his normal bacteria, and when that happens, it can predispose them to infections. Now, there are some signs and symptoms that the child might be experiencing. You can also take note of that. Number one, frequent urination. You will notice this child is urinating. In fact, even in children that are already potty trained, they tend to pee on themselves. They forget that they are not able to control the urge to go and urinate. That frequent urination is one of the signs that you notice. So when you notice that you have trained your child, and this child has outgrown peeing on himself or herself, but it happened accidentally, continuously, like once or twice, check very well. The child might be having urinary tract infection. You understand? So that is one thing you should take note of. That time is not the time that you should start getting angry or spanking the child. Look for what can be the cause. All right. The next one is painful urination. The child might be having pain. Why pain? They can say, "Mommy, my bum is," those kind of things. They can tell you how they feel. That is another sign. Now, of course, I've mentioned wetting accidents, because every time you notice that when you want to go and pee, they are running, that they are already peeing on themselves. They are not able to control it. It is UTI that can cause that. Now, abdominal pain is another thing that the child might be experiencing. My stomach is paining me. It might not just be ordinary thing. It might be relating to the UTI that they're having. Another sign is fever and chills. You might start noticing the child start getting warm, unnecessarily. You wonder what's happening. Or the child feeling so cold, more than normal, is also another sign. Now, strong smelling urine. Your urine is now very, very smelly, and you're wondering, how come you pee this much and it is smelling like this? Is another sign. Now, what can you do? First of all, it is something that you need to go visit your doctor for proper treatment. Okay, you need treatment. Another thing you can do in the house is encourage fluid intake. Make your child drink more water, not any other drink. Drink more water. It will help the child very well. Now, if you have cranberry juice, it helps a lot with the prevention of bacterial infection, or even to relieve this UTI symptom. Now, make sure that you prevent the child from. Make sure you're not using scented cleaning products like washing liquids and all that. Make sure you're not using all those scented bath soaps and the rest of them. Now, give your child probiotics like yogurt, unsweetened yogurt. Now, probiotics will help also to improve the normal flora of the child. Now, for the abdominal pain, you can give warm compress to help the child relieve the symptoms. These things, you are doing these things while you are taking the normal treatment that you must have gotten from your doctor. Okay, if you want to get the child any underwear, make sure it is cotton underwear, not the one that will be too tight and prevent air from flowing through. So this will help the child to overcome this particular issue. Okay, I hope this information helps you. Thank you for watching.